Time with Dr. Adams.
If you're a first-time mother and you see your baby hiccuping for the first time, you go like, ah. But then if you continue for a while and you see that the stress baby is in, you want to relieve baby of that. Yeah. So you might be wondering, are hiccups normal? Yes. Hiccups in babies are normal. It actually shows that the baby is developing well. They are normal. So mommy, relax. You haven't done anything wrong. You are doing a good job. Relax, please. Okay, so the one will ask, what are hiccups? All right, hiccups are involuntary contractions or spasm. When we say spasm or contractions, like a baby suddenly becomes of the diaphragm. The diaphragm is a muscle just under your lungs. So when the diaphragm goes like, then there is a prompt opening and closing of the vocal cords. Now that's what hiccups are, and they are very much normal in babies. So then, what are the causes of hiccups? You see, when babies are taking in breast milk and then they are going like, that noise that they are making, apart from breast milk, they are sucking in lots of air. The more they do that, the more air they suck in. It's one of the causes of hiccups. Breathing in too much air with whatever they are doing. Sometimes they are crying and you're also trying to feed them. So they'll cry small, then they'll suck milk small, then they'll cry small, and they'll suck milk small. They are sucking in lots of air. Okay, excessive feeding can also cause it. Anything that is making them irritable, even when it's going to irritate the esophagus, that's going to make them sneeze, can bring about hiccups. What are some of the ways that we can do, or the things we can do to stop these hiccups? We don't really have remedies for hiccups. It works for some people, it doesn't work for some people. Traditionally, they will tell you that doesn't work. People will tell you it works. The windows were down and she started hiccuping, and my mom immediately took a strand of cloth, and put it on her head. Did I say hair at the first time? No. Just a strand of cloth, ahuma, or a thread, and she put it there. And then I asked her, is it going to work? She's like, they say it works. Did it work for me? I don't know. Sometimes I allow these old people to do the things they want to do to baby. So far, it's not going to harm them. I mean, it's just a strand of thread. Ahuma keke. They usually put it in their pim. Doesn't work. If it works for you, please continue. Some people also use gripe water. We've not had enough research to show that it's a gripe water that is actually working. However, it works for some people. Others also use pacifiers. You know what pacifiers are, all right? So baby closes his or her mouth around this and sucks in. It kind of also relaxes their diaphragm. It works for some people, but the best remedy is to leave baby alone. Hiccups will go on its own. In fact, PH had one yesterday. It's been long since he had one. Yesterday he had one, and I moved from the room. He had poo, so I was looking for his wipe and his diaper and things. I moved from the room to the hall. After changing, I realized, hiccups usually will last like 10 minutes to 15 minutes. Not article. If it's lasting more than 15 minutes and it happens to baby very often, that is your cue to see a doctor. But then usually you time yourself and see 5 to 10 minutes, it would have resolved naturally on its own. Now let's talk about ways to prevent hiccups in a baby. Please, if you are feeding in a bottle, make sure that the teeth of the bottle is usually filled well with milk, not air. Sometimes you realize that the teeth is empty and the baby is just sucking in air. It will cause hiccups later, or it can even cause abdominal colics. That's when it becomes so please always make sure when you are breastfeeding in a bottle, when you are giving milk in a bottle, it's full, the teeth is full with milk, which means that breastfeeding directly from the breast is actually better than using the bottle. I repeat, breastfeeding directly from the breast is actually better than using a bottle. However, it's not all of us that are luxurious. I have just 3 months to stay at home. My mom is going to feed baby with breast milk when I leave, so she's going to use a bottle, or or cup or spoon. So fine. If you are home and you have the luxury and you have the time, you have the energy, then do it directly from the breast instead of the bottle. And then please try to feed slowly. I know we those who have boys like Fifi and PH or more magaba cry, immediately put the breast milk. You are the adult, you are the mother. Pull the breast out for a while. Let them do crazy, but then that break that you're giving them, no, all home, because feeding that fast, so there's much air. They are sucking so much air, it will cause hiccups later. So don't so off or you're fussy about the breast. No, just pull out the breast a bit, let baby relax, then you continue. Okay, so give in breaks, and when you've given the baby break, try to bear the baby a bit, because we know that when you bear the baby, it brings out air that relieves baby of that air he or she sucked in when he was breastfeeding. All right, and also try not to overfeed baby. And when you are giving baby breast milk, please let the baby be upright. And then the baby, let me use this. Phoebe and PH is speaking, I would have used them. Instead of keeping the baby upright like this, no, me, I'm short, my legs are short. I'm sure you know. Sometimes I suffer when I'm breastfeeding. So most of the times my mom brings me, or I carry my own pillow here, which supports me. So it will help baby to be a bit upright. Not saying you want more pressure. Okay. So let's keep baby upright during feeding or even when we are birthing them as well. So Charlie, relax. Why the hiccups you are seeing in your baby, totally fine. Time to see the doctor is when baby is having frequent hiccups and it's resolving after 15 minutes. Like I said, hiccups usually resolve on its own, but then if yours is lasting more than 15 minutes, then and it's happening more often, then it's time to see the doctor. Thank you for hanging. Thank you for hanging words. Thank you for sticking around. Please, if you have any questions, if you have any comments, you have any additions, how you bed your baby or how you make your baby's hiccups disappear, please let me know in the comment section below. Be kind enough to like, comment, share, and please subscribe. Thank you for watching. See you in another video. Bye.
Time with Dr.